Hi, my name is Ethan Barton. I'm a student nurse at the University of South Alabama. Here's my ID. I'm going to scan the room. Then I'm going to get my patient care order form, and I'm going to verify my order as well as hospital policy. I'm going to perform hand hygiene before I approach my patient, and then I'm going to identify my patient using two identifiers. So his name is Jaguar Jones. His armband right here says Jaguar Jones. And then we see his date of birth is 8/25/1963. His date of birth is 8/25/1963. Mr. Jaguar Jones, today I'm going to be performing an enema on you. So after I've explained the procedure, did I identify any allergies the patient has, penicillin on the armband. Mr. Jaguar Jones, do you have any more allergies I need to know of? And he does not, so we are good. So next, I'm going to gather my equipment. I have all my equipment gathered right here. Then I'm going to don my goggles, make sure I provide privacy for the patient, as well as have my IV pole readily available. And after I've done that, I'm going to perform hand hygiene. And then after I perform hand hygiene, I'm going to get my enema bag, and I'm going to come over here to the sink, and I'm going to, you should be able to see from there, I'm going to make sure I have lukewarm water, as I do, making sure that my tubing is clamped, then going to fill the bag up to 750 milliliters of lukewarm water. That. After I've done this, I'm going to ensure that I have 750 milliliters of lukewarm water, and then I would add my soap. After I've added my soap, I would then close it and then gently agitate the water. After I've done that, I'm going to slowly unclamp the tubing, ensuring that I prime the tubing and that my equipment is working properly. Then I'm going to reclamp my tubing and come back over here to my work surface, and I would place the bag on the IV pole or my work surface, not the patient's bed. And then I'm going to get my, first I'm going to gently set this down, and then I'm going to don my gloves after I dry my hands, and then dispose into the trash can. And then I'm going to don my my clean gloves. Once I have my clean gloves on, I'm going to raise my patient's bed to working height, then lower the side rail, and then I position my patient with my simulated patient right here, and then I have them in the left lateral Sims position, and then after I've done that, I will put the towel down for my patient. After I've done that, I'm going to put some lube on the towel right here, and then having my enema bag hanging from the IV tube, the IV hanger, I would then lubricate with my dominant hand in the lube. And then after I've done this, I'm going to leave that on the IV pole. It's still clamped. And then I'm going to place my hand on Mr. Jaguar Jones, tell him to take a deep breath in and out. If he has hemorrhoids, then I would ask him to bear down. And then I would slowly insert the lubricated catheter 3 to 4 inches into the patient with my dominant hand, keeping my hand on the left on the buttocks of the patient, and then never letting go of the enema tube. I would then grab my enema bag and hold it down lower. I would unclamp the enema tube usually, but today I'm just going to verbalize that. And then I'll hold the enema bag 12 to 18 inches above the patient, and then also tell him to take deep breaths throughout the procedure. And if he feels any cramping, then I would lower the height of the enema tube bag or discontinue the enema altogether by clamping the tube and removing. After the enema tube, the enema bag is empty, then I will clamp the tubing again, and then I will slowly remove. And then I would normally dispose of the enema bag but today I'm just going to set it aside for now. And then I'm going to instruct the patient to, first I'm going to get the bedpan. I'm going to put this under the patient with the largest side towards the buttocks and the skinniest end towards the thighs, and then have them over the bedpan. And then after I've done that, I'll instruct them to wait 10 to 15 minutes before voiding, so try to tell them to hold in the enema. Then I'm going to dispose my clean gloves downwards toward the trash can, remove my goggles, and then I would document the procedure. So I would document the type and the size of the enema, so type and the amount of the enema, I apologize. The patient's response to the enema, as well as the amount of secretion, and the color of the secretions, as well as how I left the patient after the procedure. And this would conclude my enema checkoff.